Bonnie is also going to talk to us a little bit today about some of the new variants that are in the area and why that matters. Bonnie, can you tell us a little bit about these variants and what's happening with the situation?
Okay, thank you, Chelsea. I thought it would be good to talk about the SARS-CoV-2 variants this week, since the Department of Health issued a press release a couple days ago, noting that the Brazilian variant, what we call P1, was detected in Pennington County. So I wanted to talk a little bit about these different variants and why they're important. There is a U.S. government interagency committee that has come up with 3 definitions of these variants. There's variants of interest that they're just sort of watching, variants of concern, which I'll talk about more, and then variants of high consequence. Now, the variant of interest is where there's a genetic change in the actual SARS-CoV-2 virus that affects either the transmission, which is how easily transmitted the virus is, or it might affect diagnostics, like do the tests that we currently have detect this virus, might affect the therapeutics or how, what drugs are being used to treat the virus, or it could affect the immune escape, what we call immune escape, which is, does the vaccinations or the vaccines working? Is the natural immunity? So if you think about these viruses and transmission, diagnostics, therapeutics, and the immune escape, is the mutation in this virus affecting those 4 things? Now, variants of interest, there are some genetic changes that might affect one of those 4 areas, but it's of limited prevalence in the US, and the effect doesn't seem to be very large. So they're of interest, they're watching them, but they're not real concerned about them at this point in time. Then we have variants of concern, which I'll talk about in a second, and then we have variants of high consequence. And these are the ones that we really do not want. They are the ones where you have significant increase in transmission. We can't test for them anymore. They've mutated so much that the tests we have aren't picking them up. And the drugs that have been developed to treat COVID aren't working anymore. The vaccines are not effective against them, and there's a more severe disease. Right now, there are no variants that have been put into this category of high consequence. The ones that we've seen are variants of concern, and this lists the ones that they're currently watching. We have the B117 variant, that's also known as the UK variant. And this is what's happening in South Dakota. There have been 64 of these variants detected in 17 counties in South Dakota. And that includes Brookings County, and we'll get back to this in a second. And with this particular variants, we do have increased transmission. That means it's easier to be spread from person to person. There's minimal effect on therapeutics. So the drugs that we have to treat COVID will work against this variant if that's the disease that you end up getting. And there is some evidence that the disease severity for this virus, this variant, is possibly increased or likely increased. Now, there's another one, the B1.351, which is the South African variant. Only one of these has been detected in South Dakota, and it's actually was in Brookings County. You have increased transmission. There is a moderate effect on the treatments that you can use for the COVID with this kind of variant. And it's not really known yet whether or not it affects the disease severity. Then we have these 2 variants, 427 and 429, that are out called California variants. 11 of those have been detected in multiple counties throughout South Dakota. I can't tell which counties they've been detected in. I know Roberts County is one of them, but Whether Brookings is also in that isn't known based on the information that's posted on the dashboard. But there is increased transmission and there is moderate to significant effects on therapeutics. So the drugs that we have don't seem to work very well at all with these particular variants. Then we have the Brazilian one. This is the one that was just detected this past week in Pennington County. It's really unknown about the transmission effect. It does have a moderate effect on the therapeutics, and the disease severity is unknown. This is the virus that is the main virus in Brazil, and it has, Brazil has seen a huge number of cases and deaths, but whether or not it's actually due to that particular mutation, the increased number of deaths isn't known. One of the things that I wanted to mention is that these variants are not tested for in every sample. So what happens is just random samples are pulled and tested for the variants. So we don't even know, based on the information that's currently posted on the dashboard, how many samples were actually tested to come up with these numbers. So there's really no way of estimating how prevalent these variants are within South Dakota. All we do know is that they're present, and if they're picking up these variants, it's likely to be more widespread than what these numbers suggest. And they are increasing the number of samples that are being tested. I think right now it's something like 100 samples, 150 samples throughout the state. That's just what I've heard. I'm not 100% sure on that. But I think they are working on improving the reporting of these variants by county, they being Department of Health. This ties back to vaccinations, because it's really important to get people vaccinated as quickly as possible for two reasons. The faster people are vaccinated, first, there's likely to be less spread of these variants of concern. If people are vaccinated, they can't be transmitting the viruses. But also, just as important, if not more important, is there's less chances of new variants being formed. We don't want new variants of concern. We don't want mutations that then lead to the variants of significant concern. And a couple things to remember about the vaccines: they are safe and effective, and they're working. If we look at the number of deaths in South Dakota, we have had a pretty constant number of cases. Hospitalizations are up a little bit, but the death rate is down. So, the vaccines, you still may get COVID, but the severity of the disease is reduced. We need to get herd immunity, and the way that's going to happen is through, hopefully, vaccines and not people getting sick. We've always said that you need greater than 70% of the population to be vaccinated, but with these new variants, because they can be transmitted so much easier, that herd immunity may actually be higher. It may be up closer to 80%. Another thing to remember is that if you tested positive for COVID in the past, it's not clear how much natural immunity you got from that and how long that natural immunity lasts. So the vaccine is really an insurance policy against your or helping your natural immunity. So that I just wanted to bring some of that information up about.
Well, thank you, Bonnie. It's interesting to know, a little bit more of what we do know about those variants. Like you had mentioned, some of that information is unknown, and hopefully, time will tell as they study these variants more and gather more information about them in general. So thank you so much for that update.